Welcome, everyone. We are excited for this next webinar episode of the Taking Charge of My PV series, an initiative to bring people in the PV community together, a place to hear directly from people living with PV and others in the PV community to help you gain insights into real-life experiences and learn how to confidently manage your PV journey. In today's episode, we'll talk about day-to-day living with PV, including experiences and advice from our guests. As we go, if you have any questions, you can type them into the chat and we will try to answer all of our questions today. But if we don't get to them all, we will address them in future episodes and or follow up with the answers. There's going to be some polls that pop up during the webinar, which we encourage you to partake in. So today, you are going to hear from two people living with PV, Gary and Tyler. Gary, let's start with you. Will you give an introduction to our viewers and maybe tell us a little fun fact about yourself?
Sure. My name's Gary Linehan. I'm from Boston originally. And been an educator for over 30 years, living on Cape Cod now. And I'm an active hiker.
You are an active hiker. What is the last peak that you attempted?
The last peak attempted was Mount Washington. We did not decide to summit that day due to some equipment concerns on some other hikers.
Oh, and some other hikers.
Yeah.
Well, that's a whole nother webinar. Gary, it's lovely to meet you, of course. And Tyler, let's turn it over to you. Tell us a little bit about yourself and a fun fact.
All right. I am Tyler Parsons. I am originally from Michigan. I am currently in Missouri at Washington University in St. Louis. This kind of can, I guess, be my fun fact too. I'm not just a PV patient, but I am an NPN researcher there at WashU in St. Louis.
You're actually Dr. Tyler Parsons.
That is true.
Woohoo! We got to put it in. We got to put it in. Well, thanks to the both of you. We're so looking forward to hearing from you and about your experiences. Gary, I'm going to turn it over to you a little bit about your diagnosis journey. Tell us a little bit about what that was like and your journey to that PV diagnosis.
Sure. So I would say about 15 years ago, 2010, roughly, I started having burning in my toes, itching, which I attributed to hiking. And I would say in 2020, that was coming more frequently, and it was happening when I wasn't hiking. So I thought I always had, I self-diagnosed as athlete's feet, plantar fasciitis. I went to see a podiatrist. I got inserts. None of that helped. So in December of 2020, I decided to go to my primary care physician. She did some blood tests. That came back with a JAK2 mutation. I had no idea what that was. I went to see a hematologist who said it was ET, but gave me we'll just watch and wait and we'll just monitor it. I came home and told my wife, Jess, and she said, absolutely not. We're going to Boston. We're going to figure this out. She researched an MPN specialist at Mass General Hospital. We went up there. They did a bone biopsy, and they decided that it was Polycythemia Vera. So my primary care physician said that I had a JAK2 mutation. I saw it on my portal, and I was in talking to my friend who hired me 30 years ago. He was also the principal of the school at the time, and his wife is a nurse. And I said, Mike, they told me I got a JAK2 mutation. And it was just the way he looked at me. And he said, I don't know what that is, Gary, but you need to get that checked out. And I went home to my wife, Jess, and she said, I told her about it. And she said, absolutely not. We're going to go to Boston. We're going to figure this out. She researched and found an MPN specialist at Mass General Hospital. We went up there to see Dr. Hobbs. She did a bone biopsy, discovered that it wasn't ET, but actually Polycythemia Vera, PV. I remember her saying PV trumps ET. And we started to plan what we were going to do, and we became very proactive. I immediately started aspirin and phlebotomy.
Thank you for sharing that story, Gary. Tyler, is your diagnosis story to have some similarities? Are there some differences? We'd love to hear from you. What was your diagnosis journey like?
I think in sharing with Gary and probably the majority of other NPN patients, there was a time leading up that you knew something was wrong, but you didn't quite know what it was. And I think for me, it started actually when I was pretty young. I had a deep vein thrombosis or a blood clot in my leg. And at 17, I went to the doctor and they did an ultrasound to find the clot, and they were able to just diagnose it, but say this was probably just a random event, and we're going to start you on blood thinners. I was put on pretty intense blood thinners, as well as I remember having to inject myself with heparin quite a bit in high school, which was not a fun experience, especially as a 17-year-old who had never had to keep track of any kind of medications or drugs or any kind of schedule. So remembering to do that was difficult for me. It was also, I had to go to the bathroom and do it in the middle of school, and it was just kind of invasive on a 17-year-old's life. And it eventually cleared, and I stopped taking all the blood thinners, and I went to college, and I had a clot in the same spot. And at that point, I had switched from being 17, where it was all pediatric hematology panels, to then moving into college as an adult, having a lot of the same tests run, and everything coming back negative again for genetic things that can cause various clotting disorders. It all came back as normal. And eventually that clot cleared as well, with the same methods of just taking blood thinners and trying to clear the clot out. And as soon as the clot was cleared out, I went back to not being on any kind of blood thinners at all. And then in grad school, I was finishing my PhD in cancer biology. And it's a time in your career where you're pretty stressed. I'm trying to write a dissertation, as well as trying to land my next job, a research fellowship somewhere. And I was having severe abdominal pain. It was keeping me up at night, and it was kind of interfering with my daily work. But I just kind of said it'll go away, just like everything else does when you're in your 20s. And it did not go away at all. And I think my fun fact should have been that Gary and I's wife have the same name. So Jessica, my wife, told me, no, you need to go to a hospital and figure out what this is. And I had scans done on my abdomen, and they found clotting in my liver, so the portal vein thrombosis, as well as extending into my spleen. And for PV patients, that is one of the more complicated things that can happen to you as a PV patient. But at the time, I still had not been diagnosed with polycythemia vera. But I was having all these PV-like symptoms. But similar to Gary, you hear these things and you get these reports, and you know something is wrong and something is serious, but you still don't quite know what that is. And again, similar to Gary, the next step was pretty clear, and that was to go find an NPN specialist that would really find what was wrong. I had a JAK2 test done just for my peripheral blood at that hospital where I had the portal vein thrombosis, the clot in my liver. And they ran a JAK2 test, and that came back positive, but there weren't really any action items or anything moving forward with that. Actually, to this day, I still haven't been contacted from the hospital about that test. So it was just something that I found in my chart online, and decided we need to go and find an NPN specialist. And they ran a bone marrow biopsy, and they were able to confirm a lot of the histological things that would be wrong in an NPN patient, as well as not just a simple test from the blood, but ran a sequencing panel to rule in or rule out all of the other mutations that can co-occur or drive NPNs. And again, there was a confirmation of the JAK2 mutation, and I was finally diagnosed there in 2021 with polycythemia vera. And I do like to close that kind of chapter with there is a lot that you are not expecting at all in your 20s, and I think something that is so pivotal with a health diagnosis that you might have so many other things in your 20s that are going to be pivotal for your life, and you're finishing a degree, you're finishing grad school, you're getting a new job, you're kind of trying to climb this career ladder. So there's a lot of pivotal moments. I don't think this is one that I was really expecting to have, but I think it's important that I face that head on and kind of just kept moving forward with the goals that I had set for myself.
Thank you, Tyler. Thank you, Gary, for sharing your experience. I'm sure our viewers have found some similarities in your stories with theirs. This is where we're going to have a poll question, everybody. We want to hear from you. Which of these best describes how you felt after your diagnosis? Please select as many as you feel that might apply. So thank you again both to Gary and Tyler for sharing their journeys to diagnosis. We're going to transition into the next section talking about the emotional reality of living with PV before finding that right treatment. I'm going to start with Gary again. Tell me a little bit about your experience managing those feelings around your PV diagnosis.
When I first found out that I had cancer, I was hearing every other word, and I was angry. I was very upset. I had always taken care of myself. Other than having a vicious sweet tooth, I exercise every day. I hike. I try to keep myself in great shape. I was on no medication up to that point. I prided myself on that. So I felt like I had to get out, and my wife understood that. I had to spend some alone time. I went on, even though it was January, I went and hiked all the presidentials in the White Mountains. I wasn't reckless. I knew what I was doing. I chose my days, but I did choose to go alone for a lot of those hikes. I felt like I had to get, you go online, you start researching how much time you have, which is the worst thing to do. And it's like 7 to 10 years. So you want to make sure you get everything, all your things in order, get the house fixed, make sure that you say the things you want to say to your loved ones, your kids, your wife. You start to really hyper focus on moments with people, the time you spend with people. I've said this in the past. My brother died at early 40s from colon cancer. He had Crohn's. So I understood cancer, but I don't think you fully understand it until somebody tells you you have it. A good friend of ours that we knew in college, she went through breast cancer twice, double mastectomy. Her and I went for some hikes in the spring of 2021, and she said, don't let cancer have the power over you. Don't let that C word have that much power. There's a lot that you can do despite cancer, and that's what you have to do. That summer, I decided that I would hike the Long Trail, 273 miles in Vermont, as a through hike to raise money for the MPN Foundation as a way of coping with having PV.
And tell me a little bit about those early challenges with treatment.
Oh, yeah. Well, the phlebotomy was awful.
Mm.
I hate needles. So every 2 weeks, I was going in to have phlebotomy at the beginning. And um, there was some great phlebotomists at Mass General. One woman in particular would walk me through the whole steps, and we had a routine of the way she would do it. So I wanted those people to treat me well and like me. I would bring them. I work at a vocational school, and we make incredible cookies there called Neiman Marcus cookies. So I decided that I would bring them a dozen cookies every time I had phlebotomy, which made me popular uh, in that department. But it was my way of trying to deal with that. I hated having to do phlebotomy. But when I did have the phlebotomy, I felt better. I felt more energetic. I had ghost symptoms too. Like I'd ask Jess, my wife, like, look at this. What's wrong with my arm? What's going on there? It itches. It hurts. It burns. And she'd be like, there's nothing there. For years, she thought I was like crazy. When I would tell her this stuff, she's like, there's nothing there. Absolutely nothing there. I'm like, all right, well, something's wrong. But yeah, it was tough to first find out that you have cancer. You don't know what it is. You're trying to figure it out. It's difficult.
It is. It is. And that C word is very heavy. It's very,
Yeah.
very heavy. Yeah.
Yes, it is.
Tyler, transitioning to you, what was your emotional reality like, those first several years?
I think right at the very beginning, it was difficult because it was difficult for a lot of reasons. One of them being it was right during COVID, and
Mm.
no one could come to any of my doctor's appointments with me. And so while we were trying to figure out what was going on, and while I was getting the bone marrow biopsy, and while I was waiting for results in the doctor's office, there was no one there. And then as Gary just said, you have your NPN physician come and tell you what you have, and what that is and what that isn't. You're kind of processing that all by yourself. And he mentioned that you hear every other word at one point when you're talking to the doctor, and that's very true. And you're hearing every other word, and there's no one there hearing every word. So when you leave the office and you can go get picked up outside, you're trying to remember everything that was said. So there's a lot. There was a lot to think about. But there was a lot to think about too with how does this now shape the future? And I think again, Gary said really nicely. You look up the longevity and you see 7 years, 10 years, and at the time that would have put me at like 34, and so it's just not good enough, right? And you want to be able to do everything that you can do to not throw away everything that you had been building prior to that moment. So I was, as I mentioned earlier, graduating at the time with my PhD in biomedicine, and that the cancer biology trajectory is a very long path to get to where you ultimately want to be. And I was not completely done, but I was getting there. Using a hiking analogy for Gary, I was getting to the summit there. Like it was a long process, but eventually. You're looking forward, you can kind of see the end, and you're finishing your PhD, and you're about to go do a fellowship, which is the last step before you can open up your own cancer research lab. And then all of a sudden you're hit with this. And it was really hard for me. There's people saying, maybe don't do this. Maybe this is a little too stressful. You have no idea how your body's going to react to this. You have no idea what the next 5 years are going to look like. But I just honestly tried to stay in control of every little thing that I could stay in control of, because there's nothing that I can do about this. That it is what it is, but I want to be in control of every single thing that I can be. And I just honestly refused to deviate off of the path that I had been building for myself, and where that was going to take both me and my wife.
Hmm. And what about early treatments? What was that journey like?
So I also started with very frequent phlebotomies, and just trying to get that hematocrit down to the levels that we had set the goal for me, which was pretty low for an otherwise healthy, active male. And I think in order to reach that range, I was needing 3 to 4 phlebotomies a month, which is very unsustainable, of course. And it was at that point I talked with my NPN specialist, and we talked about switching and what are the options out there. And at the time, I switched to an interferon therapy that it worked in keeping my blood counts down and needing less phlebotomies. Similar to Gary, after phlebotomy, you do feel better, but it's not really doing anything to take care of the underlying disease. It's kind of alleviating some symptoms that you might have. And when I switched treatment, I did need less of those phlebotomies, but the side effects of that treatment were awful for me. And I couldn't do any of the just normal activities, let alone any kind of athletic things that I was trying to do. I was still trying to play sports and play golf. And now all of a sudden I have a yard to take care of, and all these things that were being introduced in my life at the same time as this disease. It became almost impossible to do any of those things. And it really did just take out every single thing that was leisurely in my life, that was an activity that was done outside, I could no longer do. And I knew something needed to change.
Again, thank you to Gary and Tyler for sharing their experiences. Now we want to hear from you. So here's another poll. What part of living with PV impacts you most right now? All right, so let's transition. Let's transition into our next section. What were the next step, each of you? I'm going to start with Gary. What was the next step that each of you took to find a treatment that worked for you in the long term? And I'd love to hear about the impact that it has had on your daily life. Gary, I'll start with you.
So after I completed the through hike of the Long Trail in the summer of 2021, I needed knee surgery. I knew I needed knee surgery before the hike. And in August of 2021, had the knee surgery, and I ended up with 2 blood clots. Even though they knew that was a risk, when we did everything we could do to stop it, I ended up with 2 clots in my left calf. Extremely painful. I thought it was just that I needed to stretch. Again, my wife was like, no, get in the car, we're going to the hospital. Went to the hospital. They found the 2 blood clots. So I went on some blood thinners then. And in the fall of 2021, I had a candid conversation with my doctor about interferons and hydroxyurea. And BESREMi had just been approved, I believe, in the fall of 2021, maybe. And I asked her, well, what would you do if you were me? And she said, if I were you, with your history and the fact that you had 2 blood clots, I would go on BESREMi. I didn't do that right away. I said, oh, I got to think about it. And I really didn't want to go on hydroxyurea. Also, phlebotomy was not working for me. And I was getting increased phlebotomies. At one time in December 2021, I had 3 phlebotomies within about 10 days. And it just wasn't working. It wasn't bringing the hematocrit down. Platelets were still high. Red blood cells were still high. So in April, late March, early April of 2022, I started BESREMi. The nurse I went into Mass General, they walked me through, because I hated needles. So they walked me through how to do the injections. Started off with 100 micrograms and increased by 50 micrograms every 2 weeks until I reached 500 micrograms every 14 days. Now, the symptoms I had between 100 and 450 micrograms were pretty significant because I would feel like I had the flu. I was very lethargic. I felt like I just wasted for a good 24, 36 hours. I still went to work, but I probably shouldn't have. And I would just suffer through it and push myself along. But once that 24, 36 hours was up, the symptoms went away, almost like shutting off a light switch. At 450 micrograms, had no symptoms afterwards. And since then, I have had no symptoms after injection. So I don't feel lousy. I don't feel like I have the flu. I didn't know the emotional effect it had on my family until September of 2022. I got blood tests done and my numbers looked great, almost normal. And I showed my wife, and she got emotional. She made me emotional. And then I realized how much she was carrying, the burden that she was bearing, and the burden my kids were bearing. We stayed on 500 micrograms. The doctor kept me on 500 micrograms every 14 days until, I want to say, March or April of 2023. At that point, we went down to 500 micrograms every 28 days. And that's what I'm currently on. So it's been, in my experience, for me, BESREMi's been a real game changer. And it's honestly allowed me to get back to living my life on my terms, the way I want to live it, back to hiking, back to doing the things I want to do. This summer, I'm going to be doing another hike in Scotland, the West Highland Way. It's about 100 miles. I'm super excited because my wife's going to join me on this hike. 3 people I met when I did the Tour Mont Blanc hike are going to join me, 2 from Seattle, 1 from Ireland, and possibly some patients that were with me on the Soul to Soul hike in 2022. We did a fundraiser hike in the Canadian Rockies to raise money for MPNs.
What is BESREMi? BESREMi, ropeg interferon alpha 2b NJFT injection, is a prescription medicine that is used to treat adults with Polycythemia vera. Read this important safety information carefully. It explains the serious risks of BESREMi and how to take it safely. Talk to your healthcare provider if you have any questions. What is the most important thing I should know about BESREMi? BESREMi can cause serious side effects, including conditions that may cause death or may worsen certain serious diseases you may already have. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi permanently. These symptoms may go away in some people after they stop taking BESREMi. Please see additional important safety information at the end of this webinar and full prescribing information, including boxed warning and medication guide, available at BESREMi.com.
So Tyler, I'm going to turn it over to you. Tell me a little bit about your journey finding that right treatment for you.
Right. So as the treatments were keeping the blood counts down, they were giving me all those really bad side effects. And I started my postdoctoral fellowship in St. Louis in 2021. That's what brought me from Michigan to Missouri. And coincidentally, that was the same year that BESREMi was approved. And I was working professionally with a bunch of MPN specialists and with other MPN researchers, and being involved with MPN patients very heavily at my job. It was honestly a pretty straightforward decision to make a switch to BESREMi. if nothing else, just to see if the side effects would be diminished compared to the treatment that I was currently on, and still being able to maintain the productive blood count response that I was getting. And I did, and I switched to BESREMi. And when I made that switch, I had the same productive response with my blood counts, and I also did not have any of those side effects that I was having on that prior treatment. Initially, as Gary shared, as you ramp up your dose, you do have a little bit of the flu-like symptoms. I always tell people that that means that the drug is doing what it's supposed to be doing, which is to create this kind of cytokine response in your body that is inflammatory in a way that it is selective for disease-bearing mutations, and that's exactly what you want. I think if you don't feel anything ever, even at the beginning, that there might not be that mental cue that something is taking place internally that can help your disease. And so I had those at the very beginning, but then I didn't. And what that allowed me to do was not go in for phlebotomies. I was going from needing them 3 to 4 times a month to I've had, I think, 4 in the last 5 years. And so it's a huge, huge change. And that's just time too, the time that it takes to schedule them, get away from your life, get away from your career, and not really being able to manage your time effectively because you're trying to fit all these things in. Not having to do that anymore was huge. And as Gary said, after phlebotomy, directly after phlebotomy, you don't feel great either. It'll help in the next day once you kind of recoup, but you go and you sit there for a long time and then you feel awful. And it was just this cycle of having to. It was a cycle that was extremely disruptive to my life. And what BESREMi allowed was we can manage the blood counts. We don't need the phlebotomies. You don't need to go schedule the phlebotomies and take time out of your day. And it really allowed me to stay on track with the career goals that I had and currently still have, which is kind of the point. And the ability to push through a fellowship that initially people might have been telling me don't. I really like this picture that is on here because this is me presenting MPN research at an international blood conference that, again, when I was first diagnosed, I had no idea if this kind of thing was going to still be possible. And being able to go and take something that allows me to not only have the confidence to continue in the research, but know that it's not just masking symptoms, that it's also taking care of something in the background is extremely positive for me. And being able to not just continue this fellowship, but next steps, opening up my own research lab where I can do MPN research. It really, BESREMi has allowed me to kind of continue down that path, which of course I'm very grateful for.
Thank you, Gary. Thank you, Tyler. Very inspiring stories. Viewers, we would love to hear from you. Here's another one of our polls. What area of living with PV would you most like support in? Okay, before we wrap up, Gary and Tyler, we have a few questions from the audience we'd love for you to answer around living with chronic cancer on a day-to-day basis. Gary, I'd love to start with you. How does PV show up in your daily routines, and how has any of this changed once you started BESREMi?
BESREMi's the absolute, for me, it's, in my experience, it's been a game changer because the symptoms are gone. I don't have the burning in my toes. I mean, maybe I might get it once or twice a year, but it's so brief. Itching in my feet is gone. The bone pain, the ghost pain around my body, or the itching, that's all dissipated. So that's not something I think about because I'm on BESREMi. I look at my schedule of when I'm going to take BESREMi, the injection, depending upon what I'm doing. If I'm going away or if I'm going on a hike, I've talked to my doctor. So as long as I get that injection within 5 days, so if I'm going out for a hike and I'm going to be gone for 5 days, I might take it early, or I might take it when I get back. So, yeah, BESREMi's allowed me to go back to a more pre-PV diagnosis lifestyle.
Tyler, what about you? How does PV show up in your daily routines, and how has any of that changed since you started BESREMi?
I think for especially younger patients that I've talked to as well, this is the first time that there's something chronic happening that you need to stay on top of. And for me, PV definitely interjected itself at a time in my life where there was a lot of other things that were interjecting themselves. And PV, for me, before we had truly nailed down what treatment was going to be the best for me, it felt a lot more disruptive as I was trying to schedule the phlebotomies, like I was saying, or knowing that I was about to take a treatment that would help the blood counts, but make me feel awful for a while. And then switching to BESREMi allowed PV to become something that I managed and not something that really overtook my day-to-day or weekly life.
That's so great. Here's another question from our audience. Gary, I'll start with you. How has living with PV affected how you think about yourself or your life? That's a great question.
Well, that is a good question. I think initially, when I was first diagnosed, it impacted me more because I thought about life expectancy. But now that I'm under, good treatment, good care from my doctors, I live in spite of PV. It doesn't control my decisions. I feel like it's something I'm going to have to manage for the rest of my life, but I don't feel like it's a hindrance to what I want to do or how I want to live.
Tyler, what about you? How has living with PV affected how you think about yourself or your life?
I think I was in kind of a weird or unique situation that I was at a point in my life, in my career, where I was really trying to pick something to specialize in. And when this diagnosis came around, it really helped shape who I wanted to be as a professional. And it allowed me to keep a personal focus on why I do what I do every day. So while polycythemia vera, as in my diagnosis, might not be something that I think about every single day anymore because things are being managed, polycythemia vera, the disease, is something that I do think about every single day. And I think that its relationship with me shifted from being something that I was completely afraid of to something that was manageable and something that became a driver for the things that I do professionally.
Gary, are there moments when PV affects you in ways that people don't usually see or understand?
I think it used to. I think before my present treatment and my present state with the disease, because a lot of times I believe it's a wildfire and that's contained, and my wildfire for me is contained. But I think when you don't always want to share your ghost symptoms, that they're not ghost symptoms because they can be clinically proven, but you don't always want to tell people how you're feeling because well, for me, you don't want to burden people with that. When you know some symptoms are just going to go away, and there's not much you can do with PV. So for me, I don't usually want to burden people with what troubles me. And I quote Viktor Frankl all the time: when suffering has meaning, it ceases to be suffering. So because I'm surrounded by people I love and people I care for, my wife, my kids, my grandkids, my friends, for me, when those symptoms would happen, the fact that I had those symptoms and I was meant I was alive too. So there's something to be very grateful for, because when you're in no pain, you're 6 feet under. So we all suffer with something.
Wise words, wise words. Tyler, what comes to mind for you when you hear that question? Are there moments when PV affects you in ways that people don't typically see or understand?
Yeah, I think when you initially tell people that you were diagnosed with cancer, people have an understanding of what that word means in maybe a more acute sense, and maybe in a way that they will expect very quickly that you look very ill and you are going on very harsh treatments to try and eradicate something immediately that in other words or in other ways would give you a 3-month life expectancy if you didn't go after it so strong. I think the mental toll of you knowing that something is wrong, and I tell people that sometimes it feels like there's a shadow that's chasing you that eventually is going to catch up, but it's taking a lot longer with this type of a disease than it would with an acute leukemia, for instance, something that needs to be aggressively targeted immediately. And I think not wanting to burden everyone around you for the length of time that you expect to live with a chronic cancer is something that you just shield people from and hide. And other people around you might not know that, or might not know that you're doing that. And I think the mental toll is probably the thing that comes to mind for something that other people might not know is going on in your life as a polycythemia vera patient.
Where do both of you turn to support? Gary, who's your biggest support in your journey?
My biggest support, I think, is my wife for sure, and my kids, and then I think it's my faith and my philosophy in life. I lean on those.
Tyler, what about you?
I think we have found 2 good Jessicas to be supporters for us. I think my wife is a nurse practitioner, so things are not completely outside of the realm of what my caretaker understands already and can have good rational thoughts about. And I think the support system of other NPN patients, I'm very involved with like patient advocacy groups. And so just being involved with other patients who have all of these things that we've just discussed about things that go unseen or unheard, but we all have them, and we can bond over that. I think support coming in forms of someone who lives with you and takes care of you, and people who you do not live with and you see once a year at something, but there's a common shared understanding of what living with this disease can be. I think both are fantastic avenues that I have found to be able to build a community.
Gary, I don't know if you caught it, but Tyler's wife is named Jessica too. So really, truly, this is just, a shout out to the Jessicas today. Huge shout out. Support Jessicas. We love them.
There's definitely something to that name, for sure.
And they've been a through line today. We love them. Last question. Gary, I'll start with you. What advice would you give to someone that is newly diagnosed? Maybe something that you know now that you wish you knew when you were first diagnosed.
I'd take a deep breath. I'd realize that, that it's manageable. It's not a death sentence. It's not stage 4 colon cancer. One thing that I think people should know about BESREMi, because I see this in online all the time, is somebody starts BESREMi and the symptoms, they have symptoms, they don't like them, and they try it for a couple of months and they drop it. I wish people would stick with it and see where it goes. It wouldn't be so quick to just drop it because they're having severe symptoms. Pain is a sign you're alive. Pain is not a bad thing. Symptoms are not a bad thing all the time. Sometimes I think people don't allow their body to acclimate. So I wish that message could get out there.
Tyler, what about you? What's your guidance advice to someone who's newly diagnosed?
There's two things that I tell people. The first is short and not always super easy, but easier than the second thing, and that's find an NPN specialist. So you can be absolutely fine seeing your community hematologist throughout the year. They can do a fantastic job with keeping track of your symptoms and your blood counts. But when something rare like NPNs come up, you really want to be able at least once a year to have a discussion with somebody who this is really all they think about, and someone who NPNs are not rare to them because they see NPN patients all day, every day. So that's step one is finding an NPN specialist. The second thing is on a more personal note, and Gary said breathe. I tell people to find your new center, because it changed. It absolutely changed when this diagnosis came. So your comfort of what the position that you were in prior to the moment that you were told you had PV to after the moment you were told PV is different. And finding what that new center is and always trying to return to that when things get bad, when you have a scary blood draw, or one dose of your medication made you feel really sick for some reason, or your career, you're feeling like you might burn out because you have fatigue or mental fog because of PV. That there's a new center now that you have to battle the things that are new to you with this diagnosis, but it's a new chapter, not necessarily an entirely new book that you have to write. And I think being able to find that center for you that is now definitely changed, and trying your best to always come back to that, is advice that I really try and give to people who are newly diagnosed with PV.
Oh, wise words from the both of you. Wise words. It must be the Jessicas, No, but thank you so much, the both of you. Gary, we're so excited to hear more about your Scotland hike. My goodness. We'll definitely have to hear more about that. Tyler, what's up next for you? Professionally, fun?
Professionally, I am wrapping up the fellowship, and will be pretty soon here in academic terms soon. So within a year, opening up my own research lab somewhere to be able to continue doing NPN research and other types of cancer research, but definitely keeping a focus on NPNs and being able, it's my lab now. So I'm the one that gets to decide and who's brought in, what type of research we're doing. So that's of course really exciting. And finally, at the end of training 15 years later, finally being able to open up my own.
Oh, congratulations. That just sounds wonderful. Well, you guys both of you have big things that we need to follow up with. That's fantastic. Thank you for joining us today, both Gary and Tyler, and you. I know we weren't able to get to every question today, so if you didn't get to yours, we will address it in the next episode. There were also a few questions we received today that while we can't address directly about your individual journeys, we encourage you to talk to your doctor and or visit some helpful PV advocacy websites that can provide additional guidance. Here actually are a few, so get out your pen and paper. I'm going to say them for you. Blood Cancer United, which is formerly the Leukemia and Lymphoma Society, is an excellent resource. NPN Research Foundation and PV Reporter. I'll say those again so you can jot them down. Blood Cancer United, NPN Research Foundation, and PV Reporter. Visit BESREMi.com to find more stories from people living with PV and how they can manage their day-to-day lives with the right treatment option for them. In the next day or so, you are going to receive an email from us with a link to a post-event survey. We would love it if you would please take a moment to fill this out when you receive it. It will be extremely valuable to hear from you as we are planning our future webinar episodes. We'll also be sharing a link to this episode if you'd like to watch again or share it with others in your network who may find it helpful.
Mental health problems, including suicide. BESREMi may cause mood or behavior problems that can get worse during treatment or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, hopeless, or bad about yourself, unusually grand ideas, acting aggressive or impulsively, thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, call your healthcare provider immediately. New or worsening autoimmune problems. BESREMi may cause your immune system to attack healthy cells, leading to conditions such as thyroid disease, increased blood sugar, hyperglycemia, or type 1 diabetes. Call your healthcare provider if you experience extreme tiredness, frequent urination, excessive thirst. Heart problems. BESREMi may cause heart problems, including cardiomyopathy, heart muscle disease, heart attack, irregular heartbeat, atrial fibrillation, decreased blood flow to the heart. You should not take BESREMi if you have uncontrolled high blood pressure, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, a recent stroke or heart attack. Who should not take BESREMi? Do not take BESREMi if you have or had severe mental health problems, especially depression, suicidal thoughts, or attempted suicide. Have or had a serious or untreated autoimmune disease, are allergic to interferon or any ingredient in BESREMi. Symptoms may include itching, swelling, trouble breathing, dizziness, or chest pain. Have certain types of liver disease. Have had a transplant and take immune-suppressing medication. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you have any of the following: a mental illness, type 1 diabetes, heart or bleeding problems, problems with your immune system, hepatitis B or HIV infection, kidney or liver problems, are pregnant or planning to become pregnant. BESREMi may harm your unborn baby. Use effective birth control during treatment and for at least 8 weeks after your last dose. BESREMi may affect your menstrual cycle and could stop your periods. Do not breastfeed while taking BESREMi. What are the possible side effects of BESREMi? Serious side effects include low blood cell counts. Taking BESREMi can lead to infections, anemia, or bleeding problems. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nosebleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, swelling in your ankles, blood in your urine, or loss of appetite. Tooth and gum problems. BESREMi can cause tooth loss and/or dry mouth. It is important for you to brush your teeth well, 2 times each day, and have regular dental examinations during treatment with BESREMi. Skin reactions. BESREMi may cause reactions such as rash, itching, and hair loss. Increased triglycerides. You may require blood tests to monitor levels. The most common side effects of BESREMi include flu-like symptoms, including tiredness, weakness, fever, chills, muscle aches and joint pain, itching, sore throat. These are not all of the possible side effects of BESREMi. Call your doctor for medical advice about side effects. You may report side effects to Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, at BESREMi.com.